Hi, everyone. Welcome to Steadfast Care Planning, where we plan for care to live well. I'm Kelly Augsperger, long-term care insurance specialist and your guide. With me today is Dr. Virgie Bright Ellington, an internal medicine physician, medical billing expert, podcast host of Medical Bills Uncovered, and author of What Your Doctor Wants You to Know to Crush Medical Debt. Dr. Virgie, welcome. Thanks for being here.
Thank you so much for having me, Kelly. I'm excited to be here and talk with you.
Likewise, we are going to be talking about how to navigate medical bills and debt today. We know that this can be a serious problem for people in general, but I think especially older adults. So I'm really excited to learn from you, Dr. Virgie, to hear how people can navigate this and really be able to get a good handle on these medical bills. So can we jump right in?
Absolutely. And Kelly, you're reminding me of actually an important point. Just as you're saying, we think that the myth is, most of us think that medical bills are just like an old people problem, right? And the problem is that it's a huge, huge problem. It's the number one cause of debt and bankruptcy in the United States. Medical bills are the most common cause of folks going into debt and declaring bankruptcy. If you are over the age of 18, you're at risk.
Yeah. And why are you so passionate about helping people crush this medical debt, Dr. Virgie? I know you have a story. So can you briefly share why you're so passionate about helping people with this?
Yeah, Kelly, I have a ton of stories. So I am happy to say I'm a 2-time breast cancer survivor. And after my second breast cancer diagnosis, I had multiple surgeries and I didn't listen to my doctor's advice. I tell folks, always listen to your doctor's advice. And I was told no lifting. And I had one of the surgeries I had was an abdominal surgery. And I thought, he says, no lifting more than like 5 pounds or something. And I thought, I said, well, I have chickens. And his response was, what? Rightfully so, like looking at me like I said, yes, I have chickens and their feed comes in these big 35-pound bags and they have to eat. So, I have to lift, more than 5 pounds. He says, have someone decant the feed into 5-pound bags or 5-pound portions and don't lift more than that. And he walks away. He was done with me, understandably so. I'm like, oh, whatever. So you know where this is going. So I did it anyway. I did the lifting. And the problem is when you have an abdominal surgery and you lift, the sutures can come apart, which is what happened. And the bowel got caught in it. And so I was rushed into emergency surgery. It was really scary and dangerous. And so that's the rule. I have many mottos, but one of them is listen to your doc, folks. So anyway, so I wake up and I have this really wonderful hospital roommate. And after the emergency surgery, we're talking and she's telling me that she's thinking about leaving the hospital against medical advice because the last time she had been here for the same issue, she had been in the hospital a year prior. Young mom, 2 very young children. And she says, the last time I was here, I got a huge bill that I just can't afford. She said, the day I was leaving, I'd been in for like a week, and this person comes in from the billing department and says, before you can leave, you have to sign this agreement saying that you'll pay whatever your insurance doesn't pay. And so, Kelly, I tell this story all the time. It was like the curtain literally dropped, something snapped in my little brain. And I was instantly outraged because I knew she had been tricked, probably to paying something she probably didn't owe, but guaranteed what she couldn't afford. But I'm pretty sure that she didn't owe that money. It sounds like she was tricked into signing an agreement to be balance billed. And we can talk about what that is later.
Okay.
So I thought, you know what, Virgie, don't get mad. Don't get angry. Get to getting. Do something. And that's how Crush Medical Debt was born. So
get to getting.
Get to getting. Handle business.
That's right.
Get that information out.
That's right. Because people don't know what they don't know.
Exactly.
And so it's, lay people, if you're not in the medical field, we have no idea how these systems work. The hospital system, the doctor system, it's so complex and it feels like convoluted that if you don't have someone that can speak truth and like, this is really how we need to handle the situation, you're not going to know and you're just going to pay the bill or try to pay the bill, right?
Correct. Exactly. Folks living in the United States, we love our nurses and we appreciate our docs and we really try hard to pay our medical bills. And we assume, like you said, we trust that this is right. They would never send us a bill that's not correct. Well, folks, the thing is that the front office is very, very, very different than the back office, meaning the folks who are providing the care, those that are with you in the middle of the night and went to school to do all this just to take care of you, they would be outraged if they knew what was being done in their name in terms of billing going after folks by the back office folks. They're two completely different, separate universes. And the docs don't know. And I would say the physicians, whether you're in a large hospital setting or if your doc is in a large medical group, even so, they don't know what's being billed in their name. I'd say 90% of docs don't.
Okay. So if someone does have medical debt, Dr. Virgie, how can people get out of that debt and hospital bills? And I know you have like 3 simple steps, right? Without going into bankruptcy. So what are those steps?
Number 1 is getting a real bill. So a lot of the foolishness that happens, these crazy, outrageous bills that get sent, you can just nip in the bud a lot of it if you just ask for a real bill. And this is because a real bill, unfortunately, isn't sent to patients by most of the providers, meaning when I say provider, I mean usually a hospital, sometimes a physician's office. And the bill that gets sent to, if you have insurance, is called a claim. A bill from a provider to the insurance company is called a claim, is different than what gets, I would say 8 to 9 times out of 10, gets sent to a patient, because what gets sent to an insurance company for payment has CPT codes. CPT codes are to medical services what barcodes are to products in a retail store. So every medical service you can think of, every test, procedure you can think of has its own unique office visit, has its own unique CPT code. ER visit, emergency room visit, they'll have unique CPT codes. Well, for some reason, 8 to 9 times, I know it's not for some reason. We have to ask why, follow the money, right?
Yeah.
A real bill with CPT codes don't get sent 8 to 9 times out of 10 to the patient, which is outrageous. Why do they do it? Because they know that they can get away with it. So the number 1 step, the first thing to do that just cuts out a lot of craziness is to call the provider's billing department and ask for, quote, something with CPT codes, unquote. This is the number 1 thing you can do. The second thing is once you get this real bill with CPT codes, and by the way, you'll see on the top of the bill something like CPT or CPT/HCPCS, HCPCS, which is a subtype of a CPT code. Make sure it's not something like service code, because service codes have nothing to do with anything. They're just usually unique to that particular facility.
Okay.
So just be aware that a CPT code is something that's usually 5 digits, 5 numbers. Sometimes they'll start with a letter. So anyway, just make sure you're not getting tricked into, because I've seen patients getting, I got the CPT codes, look, and it's a service code. It's not a CPT code.
The wrong number. Okay.
Yeah. So once you get a real bill with CPT codes, you're going to take those CPT codes and do an AI search, is what I do now. Google search, but it's much faster now to do an AI search to find out, number 1, what's the definition of that CPT code? And very importantly, what Medicare pays for that CPT code. Because what Medicare pays for CPT codes for medical services are the most fair, lowest retail rates that providers will accept in the United States. That's a place that you're going to say, okay, this is a more fair price to pay.
Okay.
So once you get that number, you're going to total up your new bill. And this is the new number that you're going to say, okay, this is where I'm going to start from. This is a start closer to what I actually owe. And so that's step 3. You're going to take that new number, that new total of the CPT codes, what Medicare pays for them. You're going to call back the provider's billing department and say, hey, yeah, you know that bill you sent me, I was there for an emergency hernia surgery. I know you asked for $10,000, but, quote, in my case, I am willing and able to pay, and this is a hypothetical example, $3,000, unquote. Now, I use this example a lot, Kelly. It sounds outrageous to say, 3,000 down from 10,000. The numbers really are that crazy in terms of the differences and what's actually,
Oh my goodness. So Dr. Virgie, those Medicare numbers, like when we're using AI or Google, does it matter though if a person's not on Medicare? Like if they're under 65, does that come into play?
Excellent point. People's eyes just glaze over usually when I tell them that, because they're like, well, Medicare, I'm not old. I don't have Medicare. That doesn't apply to me. You don't have to have Medicare to say, I'm not going to overpay.
Okay. Great.
And this is really important. Don't tell the billing person that you're talking to saying, well, I looked up the Medicare rate and blah, blah, blah. That's TMI. That's too much information.
Yeah.
They don't need to know that. They don't need to know the number that you're starting your negotiating from. This is automatically negotiating without really negotiating.
Mm-hmm.
You're just saying, this is, in my case, I am willing and able to pay blank. Don't get into any conversations about insurance or Medicare or anything like that, because that gives them the opportunity to say, well, you don't have Medicare, or we don't accept Medicare here.
Yeah. Wow. I had no idea that you could negotiate that much, Dr. Virgie, with some of these. This is really groundbreaking, I think, for people.
It drives me crazy because there are personal finance experts that are like on TikTok and, Instagram and all that. And they say, oh, negotiate, call them up and say, well, if I give you such and such for a $10,000 bill, if I give you $5,000, will you accept it? Well, yeah, they'll accept it.
Yeah.
And it's more than what you probably owe. So these 3 steps, Kelly, also want to point out, applies to everyone. Definitely if you don't have insurance. But even if you have insurance, because the average deductible, I think, is now up to $1,500, just say between $1,200 and $1,500 a year. So every year when the clock strikes, when the bell drops or the ball drops, whatever, most of us, January 1, are officially uninsured. Most of us with deductibles are uninsured until we meet that deductible.
Sure.
And most of us will not meet our annual deductibles in an average year.
Yeah.
So you go to the billing office and say, hey, you know what? I'm paying cash.
Mm-hmm.
And don't let them tell you, oh, you have insurance, so you have to use your insurance. No, you don't. Now, if you choose to use insurance, the provider has to bill the insurance first before they bill you. But just in an average year, start out saying, you know what? I had pneumonia. I found out that, this cough wasn't going away, and I'm told that I had walking pneumonia.
Right.
Yeah, right? You know what? Even in that case, you're probably not going to hit even if it went through the family and everybody in the family got, walking pneumonia this year, you're probably not going to meet your deductible. So start out paying cash.
Yeah. Great.
And what's the cash rate?
Great tip, Dr. Virgie. The Steadfast Care Planning podcast is sponsored by the Certification for Long-Term Care, CLTC, an in-depth training program that gives financial advisors the education and tools they need to discuss extended care planning with their clients. Look for the CLTC designation when choosing an advisor. If you're looking to become a CLTC, enroll in their masterclass and enter Kelly in the coupon code field for $200 off. What about, so with these CPT codes, what are some definitions that people need to know in order to catch some of these common CPT code and medical billing mistakes?
Yeah, Kelly, I feel like this is not your first rodeo. These are awesome questions. Thank you for pointing out these issues. So people think they have to know, memorize the CPT codes and know what they are. No one. Actually, last I looked, there was more than 300,000 CPT codes in the AMA. Yeah, you can't memorize them. Those of us who do this line of work, yeah, we know some of them that are really common, but there's no way you're going to know them. What you're doing is making sure that what is described sounds like the care you receive, the services you receive. For instance, let's say that your kid falls out of the tree and, goes into the emergency room and it finds out that he has a fracture. His arm is broken. Mm-hmm. And so you guys are on vacation and they made a phone call to an orthopedist who's closer to your town, to your home. And you're going to go there in 3 days and see the orthopedist and have the arm set or actually have any intervention done there. Okay. So in the emergency room, the doc is going to just put the arm in a sling and send you on your way. You get a bill from that emergency room a month later, Kelly, and it says humeral fracture intervention, the CPT code for that. I won't bore you with whatever it is. All right. In your mind, you're like, he gave my kid a sling. He put my kid's arm in a sling. What intervention was done? There was no intervention done. So it keeps you from being tricked into upcoding, what's called upcoding, overcharging, upbilling. So just making sure you're not getting duplicate billed, or again, most common is upcharging. Just make sure it sounds like roughly the services that you think that you received.
Right. Okay. And that's probably where Google and AI come into play, right? And where they're really helpful. Because you can just put in those codes and it's going to give you some definitions of what this means and what it is.
Exactly. And there's usually multiple different kinds of definitions, like pieces, phrases, that kind of thing. So just keep Googling the number or do an AI search of the number until it sounds like something that you understand and sounds like services you received.
Okay. Well, let's say we have these billing mistakes. How can people effectively communicate with their doctor to fix it? But I'm assuming your answer is going to be, well, we're not going to be talking to the doctor, right? We're going to be talking to the billing department.
Thank you, Kelly. Exactly correct. You got it. We're going to be talking to the billing department. The docs have no idea what's going on with what's being billed in their name. And they would be outraged if they knew. You're only dealing with the billing department.
And give us that quotation again, the verbiage that you gave us a few minutes ago.
Oh,
to the billing department. Like if you're...
If you're calling to find out to get a real bill.
Right. And then if you feel like there are mistakes, in my case, I believe.
Yes. All right. So in my case, and there may not be mistakes. Just, what we're doing is automatically negotiating without negotiating because it sounds very scary. We think we have to know medical terms or we have to have like an assertive personality or have a gift of gab or be like a lawyer to be able to advocate for ourselves. And what we're doing is just applying the system, the 3 steps. You're automatically negotiating without negotiating. So once you get the number that sounds right, meaning you've got the CPT code, so it sounds like the services you received, and you totaled up your new total, meaning what Medicare pays, then you're going to call back and you're going to say, quote, in my case, I am willing and able to pay blank, unquote. Now, people who do this work, there are several that say, you know what, Medicare is such a low number. Many hospitals and facilities will say, well, you know what, if everybody only paid what Medicare pays, we couldn't stay in business. Well, actually, there was a study done a year ago that shows that that's really not true. We suspected it's really not true. And we got some data that shows it's not true. But for that reason, some folks who do this work, Kelly, will say, okay, we start our negotiations at 2 times Medicare rate. So they'll say, in my case, I'm willing and able to pay 2 times blank, in their head. So if the number that I come up with, I use Medicare rate. So if I come up with a number 3,000, they'll start at 6,000. As an example.
Okay. Well, what happens if people, let's say they have private insurance or Medicare, but then those insurance plans won't cover their medical costs. And so they have to come out of pocket, whatever it is, X.
No, don't say that. No. It doesn't have to come out of pocket. If they don't pay for it and you go to your physician, that's when you talk with your doc, your physician, and say they're not paying for this. If you and your physician felt it was medically necessary. Now, it's different if the doc said, look, insurance is not going to cover this. This is likely not covered because it's experimental or considered cosmetic. No, right? But if you and your doc said this is something that was really medically necessary, you're going to appeal that denial. And there are insurance companies, unfortunately, that have business models that count on they do automatic denials, and they know that less than, I think like the number is like 1% of people appeal the denials. So it's a business model. So no, we're not going to just automatically pay it just because the insurance says no. We're going to appeal it. And the best way to do that is actually to call your doc. Think about it. They want to get paid, right? So
of course,
they're like, right? There's multiple insurance companies and they have different policies and they do this all day, every day in their billing office or their billing manager or person. Say, look, I just talked to my insurance person or I call the number at the back of my insurance card. I talked to the customer service rep and it was denied because of this. And the doc believes it's medically necessary. I always say, don't ask closed-ended questions, right? It just gives people an opportunity to tell you no, because if they're overwhelmed or don't know how to help you, they'll say, no, can't help you.
Yeah, good point.
Right? So open-ended questions, what, how, where, why? Who can I speak with who can help me write an appeal to the insurance company? This is what they do. And the doc will say, this is why it's medically necessary. And ask the doc to write the letter supporting your appeal to the insurance company. And your physicians or the provider, if it's a hospital office, billing office will help you with that.
Wow, that's fantastic. So you don't have to do it yourself. You don't have to go to Google and figure out, how do I write this appeal? What kind of verbiage is necessary? Yeah.
With insurance, because the provider is also not getting paid, it's really easy for them. And this is what they do. If you tell them, look, I don't have the ability to write this appeal of this denial, to write the appeal, please help me with the information that I got. For instance, some of us will say, you know what, I feel comfortable when I talk to the customer service rep at the insurance company for them to tell me why specifically it was denied. Usually it's not medically necessary or things like that. And then you could say, okay, well, what clinical policy, meaning if it's not medically necessary, they have a clinical policy to say why the particular diagnosis or CPT code wasn't applicable and why they're not covering it. If you're comfortable asking that, you can say, when you call your billing office, you can say, you know what, I talked to the insurance company. They said it was not medically necessary based on this clinical policy or for this reason. Can you write the letter, the appeal based on this information? This is what the insurance saying, why they're not covering it.
Okay. So really the point is there are people that can help with the appeal process. You just need to ask, right? You just need to ask your doctor's office. Yeah.
The billing office, exactly, or their billers.
Yeah. Okay. The Steadfast Care Planning podcast is sponsored by Amada Senior Care. Amada provides complimentary consultation with a senior care advisor to find the right care from in-home caregiving to community care, as well as long-term care insurance claim advocacy and unique support partnerships for financial advisors to address family transitions and generational retention. To learn more, visit www.steadfastwithamada.com. What about free resources? I know that you've talked about, there are free resources and strategies that are available to help people manage and overcome medical debt. So what are those resources?
I really, really love the Patient Advocate Foundation, which does all of this help for you for free. I mean, they'll do everything up to, unfortunately, there are cases and there are states in which facilities are allowed to garnish wages of people or put liens on their homes, unfortunately. So they'll do everything in terms of help you except going to court with you. That they can't do. But they can do all the things I talked about, like help with writing an appeal and that kind of thing. That's a great resource and it's free. Patientadvocate.org. I can't recommend them highly enough.
Great.
There's also, this came up recently, Kelly, that it just really gets me upset. So on TikToks, this young lady, like in her 20s, just diagnosed with type 1 diabetes, can't afford her insulin. And she had a subsidy for like the federal marketplace insurance, but lost it because she got a better paying job, but it's still not enough for her to cover this full freight for, it was like 3 months supply of her insulin was like $600. And she's like in tears, recording this, and she shows the bill and, so she's just not making this up. One thing I really want folks to know is go to insulinaffordability.com for resources and how to get, like Lilly provides, Eli Lilly is a huge #1 manufacturer of insulin, provides insulin for no more than $35 a month.
No kidding.
Yes, for U.S. residents.
Wow.
So, and then they have other resources, if there's things that apply or don't apply. So please, you and I are having this conversation in November, which is National Diabetes Awareness Month. So I just thought it was very interesting that this came up, that I saw this, and it just, again, outraged me. And so anyway, that is something that I've been putting ads out on IG, like, if you can't afford your insulin, please go to insulinaffordability.com. So that's that resource. Then the other thing in terms of affording medications is when you go to, whether you have insurance or not, when you go to the pharmacy, often actually they'll volunteer this. Ask them to see if there are any discount cards that are applicable to the particular prescription that'll discount it. There are free discount card programs that do advertising on TV, and they're actually not always the lowest one. Usually they're not. In terms of, there's a bunch of different ones. One that I've actually found, and it's not always, none of them are always the lowest, but singlecare.com has the lowest most often prices for prescriptions. Now, what will happen is if you don't download a card from Single Care or any of the other providers' free discount card programs, when you go to the pharmacy, they'll usually say, you know what, before you pay that, let me run it through some of these discount cards and see what the lowest rate is, if I can get it down to a lower rate.
That's fantastic. I haven't heard of that one before. I've heard of GoodRx. I think that's probably a pretty common one, right? People probably know of.
There's reasons why they have the most funding, so they have the resource to do this big PR campaign, but they're usually not the lowest price.
Okay,
but
so Single Care.
Single Care, and there are other ones. Just ask the pharmacist, hey, are any of the free prescription discount plans covering this? You can get it down to a lower price.
Okay. Well, good tip there, Dr. Virgie. What about how can people navigate complex emotions that come with an emergency medical procedure or chronic diagnosis while at the same time dealing with their financial health? And I know you know this all too well with probably your breast cancer diagnosis and treatment. So help us here.
Yeah. The number one thing I tell folks is when you're going in to talk to a doc, to your physician, and there is a possibility of you think there's something serious going on, you're worried, or maybe not worried, but there's a possibility that there's something serious that you're going to have to address, that you're looking into. I always say, if there's a remote possibility of hearing difficult news or bad news, bring an extra pair of ears. Bring somebody with you because it's kind of like we kind of turn into like the Charlie Brown show, right? Cartoon, wah, 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 wah. You know, after you hear something, it's just human brain. We're stressed. Yeah. You know, just it is life. And so the number one suggestion I give folks is that if you're worried about anything, you're not worried, but you're not really sure that you're getting all the information that you think you need, bring somebody with you.
Yeah. Having that support person and another set of ears to actually listen to make sure you really understand what's going on. Because when emotions are high, our brain tends to kind of shut down and you're probably not going to absorb everything that the doctor's saying.
Yeah.
Great tip there. Okay, Dr. Virgie, how can people plan ahead for their medical costs? So maybe we're not in debt now, but we want to avoid that medical debt. How can they plan ahead?
It's just a human condition. No one buys life insurance, frankly. No one thinks, death is what happens to other people, right? Nothing is, right? I'm going to, die in my bed at the age of 104, die in my sleep at the ripe old age of 104. I'm never going to have an accident. I'm never going to fall. Right. I'm never going to have an illness. Nah, it's just the human condition. We don't plan for things. And the belief is that, okay, well, if everybody has insurance, then things will be more affordable. And that's not the case. In 2010, when the ACA, the Affordable Care Act, was put in place, it meant that pre-existing conditions were not allowed. So the insurance companies had to take all comers. And that meant that they couldn't not give policies to those that are high risk, right? More likely to file a claim. So that's how they make their money, is by not paying out on claims.
Right.
So the traditional health insurance premiums may not be the answer because many people, Kelly, can't afford the traditional health insurance premiums. To say, okay, you should have an emergency plan, well, should. I say, don't use the word should. Don't should on others and don't should on yourself. Don't use that word, right? It's very judgmental. Yes, we all know we should have an emergency plan, but life happens and So it'd be great if we had those resources, right? What I suggest is that if you cannot afford regular insurance, health insurance premiums, traditional health insurance premiums, then look into getting an accidental coverage. It's historically called supplemental because you would get them as a supplemental policy through your employer. But this is something you get on your own. Exactly. Accidental, critical illness, and or hospitalization insurance. That's what you're looking for because it's the big bills that are going to really hurt you. And, the accidents that happen in life, things that we don't expect. Most people who are diagnosed with breast cancer have no family history. I have zero family history, and I was diagnosed twice with, 2 separate breast cancers, 2 separate breasts. Take it from me. Like I say, listen to your doc.
Yeah, right.
Always listen to your doc's, your surgeon's advice or doctor's advice, and don't go without insurance. At least if it's not traditional insurance, what I call catastrophic event insurance, Kelly.
Some coverage better than none.
Just for the catastrophic stuff that's really going to take you out.
Rack up a lot of debt.
Take out your finances and destroy your financial future.
Right. Yeah, wise advice there, Dr. Virgie. Well, any final advice on how people can plan for care or plan for medical expenses to live well?
Yes. The biggest cost when you're really racking up big medical bills, it's usually because they're related to a hospitalization. If you've gotten a big bill from a hospital visit or hospital stay, whether the hospital is nonprofit or for-profit, no matter if you think that you make way too much money, always, always, always please call the hospital's billing department and ask for a financial aid or charity care or financial assistance application because by federal law, nonprofit hospitals, medical centers, and facilities have to give sliding scale income discounts to those in the communities in which they operate. But sometimes for-profit hospitals, for the very same reason, for tax write-offs, they have just as generous, if not more generous, financial aid application, or I should say financial aid programs, where they discount a bill depending on your income. Now, again, many people will say, well, gosh, there's no way I make like $100,000 or $150,000. There's no way that I'm going to qualify. And for most things, you wouldn't, right? Mm-hmm. But I had a case where there was a woman who had, I think her gross salary is almost like $150,000. And she had a $10,000 bill left over that was her share after insurance from a hospital stay. And this was an academic facility, by the way. Most academic, not all, but most academic facilities are nonprofit facilities. And they tend to have the most generous, in my experience, the most generous financial aid programs and most generous discounts. Okay. So anyway, this particular academic facility and the $10,000 bill that she owed after the insurance paid their part was completely wiped away.
Wow.
Because they had such a generous, Now, not every facility, you can have two different facilities in the exact same town and have very, very different formulas that they apply for determining how much and who gets financial aid.
Okay, understood. So even if you think you make too much, you might not. There might be some kind of resource. Yeah, doesn't hurt to ask. Well, Dr. Virgie, thank you so much for being here. Where can people find more information about you and your book?
You can find everything at crushmedicaldebt.com. And you can also find me at Voice America has a great podcast platform, but in any place you like to listen to your podcasts, we have Medical Bills Uncovered where we talk about these issues every week.
Okay. Well, fantastic. Dr. Virgie, thank you so much for your time and expertise. Really appreciate it. I learned a lot today, and I think our listeners and viewers will as well. So thank you so much and have a wonderful day.
Thank you for having me, Kelly. You have an awesome one.